pregnancy, and kind of some of the differences that you're going to have to face and overcome as you start dealing with trauma in pregnancy. Okay. So trauma, this is the leading cause of death during pregnancy. Okay. Nowadays they go, you have to do this intake thing and make sure you wear your seatbelt all the time because it gets very uncomfortable and very difficult sometimes to wear your seatbelt. MBAs cause 50% of prenatal mortality. Okay. So 50% of the reason that baby will die in utero is due to a car accident. Consider a possible pregnancy. And I'm going to tell you this, in everything that you do, that you deal with someone within the ages who, which is basically 10 to 60, 50, okay? Anytime you deal with a female of what they call childbearing ages, you have to assume she's pregnant, and I don't care what she tells you, okay? Some of them legitimately don't know. Some of them know and don't tell, kind of thing. You're better off to assume that they are than get burned because they were and you didn't know. Okay? I'm not telling you to call everybody a liar. I'm just telling you it needs to be in the back of your head. All right? All right, so trauma in pregnancies, basically your priorities are the same. It's going to be ABCs, right? Pregnancy has some effects on your airway, but that's a little bit later, right? You don't have the capacity, you don't have the reserve, you can't pull down, you just don't have the space, okay? But circulatory is where it's going to have a pretty profound effect, so we're going to talk about that. Most common cause of fetal death from trauma is maternal death. So basically, if mom dies, baby's dying. I mean, that kind of makes sense, right? Babies can't maintain or sustain, so if mom's bleeding out somewhere, guess what? So is baby. That's just kind of how it works, okay? If she stops pumping blood, so does the baby. All right? So what's good for mom is good for a baby, and that's kind of a philosophy that you need to kind of become pretty familiar with, okay? Alterations of pregnancy. So what happens? So as pregnancy progresses, heart rates increase, and generally your blood pressure decreases. Okay, remember the higher the heart rate, the lower the blood pressure? Okay, it's not an absolute rule, okay? But it's just the more blood volume they have, the faster my heart has to pump, right? But the lower my blood pressure can be because I'm able to circulate more based on my rate. Okay? Normal pregnant vital signs can actually mimic hypoperfusion. Can mimic hypoperfusion. Okay? And then assessment can also be more difficult. Right? We just talked about abdominal trauma the other day, right? And so it's real easy when you push here. What's underneath here? What's in my right upper quadrant? Liver. What's in my right upper quadrant right now? Yeah, because it's not liver. Okay, so it's very difficult to assess these folks. There's some other things that make it very difficult to assess. My blood volume increases 40 to 50%. Okay, so how does that affect me when I bleed? When I'm in shock? I can have a 30% blood volume loss before you ever know I'm bleeding anywhere. Because I have the extra blood volume. Okay? So I can bleed 30% more before I start showing those signs because I have the excess. Okay? And then reversal of hypotension is much more difficult. Okay? Here's kind of what you have to remember. Simplest terms. Did I go up? Oh, I'm sorry, hypoperfusion. Yeah. So, essentially, in the simplest form, this is a parasite. Okay? Actually, literally, my body views it as a parasite. In fact, my hormones cause my immune system to drop. Do you know that? Women who are pregnant have a decreased immune system because otherwise we fight the growing infant. Okay? So it actually decreases. That's why you're a higher risk for getting sick, and you have to avoid some other things that normally you wouldn't have to avoid. Okay? So what happens when I start needing oxygen, or I start losing blood, or I start having a seizure, or I start any of that? What happens? Yep. Sure does. So if I start having a seizure, right, because I become hypovolemic or I have a head injury, immediately that placenta gets clamped. Okay? And so it decreases everything going to the baby. All right? So, now, when we're normal and healthy, and that's why women lose hair and teeth, because the baby takes everything. But when it is life over limb, when my body starts kind of shutting down.
Is that how miscarriages happen? Is when your body shuts down and takes stuff away from the baby? Or?
No. Miscarriages happen due to significant developmental problems. Generally, if you have a miscarriage, it's because there's significant abnormalities with the fetus. Okay. So, blood flow to the uterus and placenta can be reduced significantly. Of course, the fetus can be in distress when mom isn't, or when she doesn't show signs of distress. Okay? So, adequate resuscitation of mom does not ensure that the baby is adequately resuscitated also. Okay? And we're going to learn late... Huh?
There's nothing we can do about that.
Rapid transport. That is absolutely a rapid transport type situation, because that really can be life-saving measures, even for one that may not seem life-saving. So we may have to get kind of information from our scene. So if it's a little fender bender, okay. If I'm involved in a significant MVC, now we need to kind of go, even though mom's shown that she's okay, we really need to get her out of here. Okay? Leave it up to the people who have more extensive equipment like ultrasound. Okay? So, the uterus can actually compress on the inferior vena cava, right? Because remember where my vena cava comes? Right up here, and it kind of gets into this right atrium, right? Because it's returning all this blood from my body, all this excess blood even from my body, back to my right heart, so it can get oxygen and go back out, right? The weight of a gravid uterus means basically a uterus that has a baby in it, okay? The weight of that can actually decrease or cut off your vena cava.
So is that why they tell you not to sleep on your butt?
Yes. Yes. Okay? And we can't transport them on their back. That's how it's going to pertain to us. Right? You transport them on their back, now you're decreasing their cardiac output because you're decreasing the return of blood to the heart. How do we fix it?
Turn to the left.
Yeah, turn them to the left. What about if they're on a backboard?
Still do.
Yeah, tilt it. Throw something underneath the backboard, tilt it sideways. Right? They don't have to be completely on their side, but you have to do enough, just enough to displace this big old heavy uterus and the weight of the baby and the umbilical cord and, you know, all this kind of stuff that we have going on. Okay? All right. So, how are we going to take care of pregnant people involved in trauma? First of all, we're going to recognize that even though they're stable, they probably need to be transported and evaluated. Okay? That's important. Manage the airway like we would anybody else. Okay? C-spine control when appropriate. That doesn't change. Right? We may have to get creative. We may have to do it a little bit faster because we need to get her off that side there, because that can have a pretty profound effect. Okay? High flow O2, especially in the third trimester, the O2 demand increases 10 to 20%. So I require 10 to 20% already more oxygenation than any of you sitting in this room. So now, add 2, I have decreased capacity. Now I'm laying flat and I have a decreased blood return to my heart. Right? These guys definitely need high flow O2, even if they're not showing signs of hypoxia. Okay? Everybody kind of with me on that? Excellent. And then, again, assistive inhalations as you need to. Right? As anybody else would. Or as you would for anybody else. I'm sorry. So, if the mask pants are used, you can inflate the legs only. And again, you have to have at least a 30-minute transport, and she's already got to be tanked, and she's going to die if I don't do it. Okay? Transport patient again on their left side, or elevate the side of the spine board, which is convenient since the stretchers, if you have a side mount stretcher in your ambulance, guess what? it sits all the way over against the cabinet, so you can't access the right very well. So you just tilt them, and now they're facing you. It's a little bit more convenient anyway. Okay? Never in my life have I seen an ambulance that mounts to the left side of the a stretcher that mounts to the left side of the ambulance. Okay? Convenient. Questions? A lot of information in just those few slides, wasn't it? No questions at all? Okay.
So is it always bad to sleep on your back when you're pregnant?
Especially in third